Alright guys, into this video, just get it simple. We're going to learn about fibroid today. I'm not even hearing about fibroid. What is fibroid? So don't skip this video, stick there. We're going to talk about the definition of fibroid. What is fibroid? We're going to talk about the different forms of fibroid, how it can appear, how it comes on the different types. We're going to talk about the signs and symptoms, if possible. I mean, what are the things that you can feel to note whether you have fibroid or not. So we're going to also talk about treatment options. So please don't skip this video. Let's go there quickly. Alright, so what is fibroid? Most time people send me inboxes saying that, man, we can listen to your video, but your terminology too much. So we don't understand. So let's talk in simple English today. It's very simple. So fibroid is certain growth on the womb. Sometimes outside the womb, or inside the womb, or in the muscle of the womb, so onto the cervix. So that growth can affect woman, and sometimes it does not affect you. But let's go further. We'll discuss it good. So don't skip the video. Sit down, listen to it good, or maybe just download the video if you are busy in your office. Go home, quiet and play it. So let's go that quick. So fibroid is the abnormal growth that we just talked about. Alright. Do we have causes of fibroid? Is there anything that can cause it to happen? People can wonder what it causes. Nobody ever told you before. So to tell you now, there is no known cause of fibroid. The people don't know here. Doctors not discover a fibroid cause. What it causes fibroid, but they know certain things that can make it to develop. If it starts developing, I can give it more opportunity to grow. Number one thing they say, let's look at the people that are at risk. Fat people, very big body people, they are at risk of getting fibroid. And then studies show that for the fact that you are able to bear child as a woman, you can get fibroid. You are not free. And another study shows that the bearing child process is governed by your body hormones. So the alteration or the change in your hormones level can also make fibroid to develop. So, but the actual definite cause of where it started from is not known yet. The people don't know yet, that don't know yet, they haven't discovered it. So, let's go there. What ways fibroid develop? What are some of the ways? What are some of the places on the uterus, on the womb? So, let's look at this bowl. So, this is the womb that we just show you through the diagram. And this is the fallopian tube. This is the ovary that can release egg into the fallopian tube and come sit down in your womb here. So we got the left and right tube. So in the womb, the fibroid can sit down so many places. So let's get the types of fibroid. So we have intramural fibroid. That means the fibroid can develop in the muscle. Here. It will be here. It will be here. So fibroid can develop in the muscle of the womb. It's called intramural fibroid. So this kind of fibroid, if it develops in small size like this, it does not affect you. Doctors advise that don't go for operation. No. For the fact that it's just here, it does not affect any pregnancy ability or nothing. No. It doesn't affect you. So, if someone says, but what at the point it grows bigger, then you can seek advice. So this is one type of fibroid. It's called intramural fibroid. Alright, the next one is subserosa fibroid. That means the serosa area is this part of the womb outside. So the fibroid can start growing outside like this. Or let's use this. The fibroid can start growing outside the womb like this. Subserosa fibroid. So you see the thing, the whole womb like this, then it start developing from inside, then they start growing outside. So that's another form of fibroid. Anything can bother people. So sometimes anything grow bigger, it can be a problem. And you see that something like one big lump on the left side, so you see that one part of the stomach will just burst out. So you're thinking that you're pregnant, pregnancy test negative, but it's always there. So we'll get to the symptoms that people can experience, but let's know the different ways the fibroid can get on your womb. So the first one we say in the muscle, intramural. The next one we say it can get ulcer here, subserosal. The third one now is submucosal. They start coming ulcer. So let's take for instance now. See the place the fiber growing. Now fibers are growing here, and you ovulate, you release egg. During ovulation, it travel. And the egg want to sit down. The fibroid right there can give it to sit down. So the egg now that being fertilized, the embryo, it want to implant. That means it want to attach to the womb so it can develop into baby. But the space that is about to sit down because the tube release egg, not the tube. At least they won't release egg, so the egg was fertilized and keep rare. So it want to grow baby right on the spot, but the fibroid there is taking in space. So maybe this embryo will try to start developing into baby, but because of the space of attachment not enough, miscarriage will happen. So this is one way fibroid can cause miscarriage. So that is submucosal fibroid. Alright, submucosal and subserosal, they got another form of fibroid in common. So at this point, we have the pedunculated fibroid. That means it attached with small attachment. So let's go to the subserosal pedunculated fibroid. Here, it will attach like this. Then it starts to develop like this. So small thing hanging like, have you seen somebody like that kilo on the ear? The person put the ear and some kind of growth just hanging and just growing big, you call it kilo. That's how it grows. With tiny attachment that they hanging. Same thing can happen inside the womb. So we say the submucosal pedunculated fibroid. That's how it can grow as well. So you see it attached like this. So all of this form of fibroid, they got ways of affecting you. So how does fibroid prevent you from being pregnant? It depends on the location of the fibroid. So what are some of the places fibroid will appear that will interfere with your pregnancy? So we are saying this because women go through a lot, and we want to help get this knowledge so that you can know what to do. Because most of you, your tubes can be blocked with the same fibroid thing. So look here now, let's see. Fibroid developing as this, and it developed here as it starts developing from the wall and extend all the way. What happened to the tube? It blocked. God forbid. Another one start here. What happened to the two tubes? They are blocked. So, how can your egg now pass here to come to be fertilized? How can the sperm cells travel here to come to be fertilized? It's impossible. So, this is the reason why most time now, in the case, because of the extension of the growth, you'll be having pain here and here. You'll see menses. That's why people will see that menses are blocking your menses. Because egg will be released. And the only thing is that it cannot be fertilized, but if the egg is not fertilized, it reabsorbs after 24 hours. And then menses will happen. So, this will only prevent fertilization and pregnancy will not happen. And as it grows bigger, it causes distension within the tube, and then that pain will be happening here and here, at the right and lower pelvic. So one other place fibroid can develop that can prevent a lady again from getting pregnant, most commonly involved here. So let's assume you have a fibroid that starts to develop at the cervix area, and it grows bigger like this. It happens. So these kind of people will experience very low stomach pain because it isn't getting big. It causes pain. So then in this case now, urine intercourse will be very painful, a serious discomfort. So these are the type of fibroid, and these are the various locations, the different ways they can appear on the womb. Now, what are possible symptoms? So the symptoms of fibroid are not definite, or you can say a point at a symptom of fibroid totally. It can be fibroid or it might not be fibroid. So let's get there. Number one symptom can be painful intercourse, constantly repeated painful intercourse, and you treat infection, yet you are still having it. It's because of this fibroid growing on the cervix. So what will happen is, upon intercourse, once the penis hit the cervix, there will be pain here and you'll be having discomfort. Now these are things that are affecting relationships. Your husband will not understand you, your man will not understand you. He doesn't know you're going through pain, and he might not even want to help you solve the problem. So that's one symptom. Two, you will be having heavier bleeding during menses than the normal. Sometimes you bleed for more than 8 days, 10, 9, 10, 11 days. Prolonged bleeding. Please don't get it wrong. Other factors can cause that, which can be hormonal imbalance, but consider fibroid as well, so that you go and do a checkup. So, prolonged menses, then usual heavy menses. Then, the third symptom that you have is frequent urination. How frequent urination? When the fibroid grows very big in the uterus, you see your fibroid just grow in the uterus and they're big. And in front of you get distended, which is one of the symptoms too. Distended stomach, big stomach, you think you are pregnant. So when the womb starts getting big, what happens is that you get a womb right under the bladder, a PP bladder. So the more the womb gets big, it can suppress the bladder, the PP bladder. So you see that the womb getting big, it reduces the space in the bladder. So if the bladder used to take 500 milliliters of urine, it will not be taking 500 again, it will drop to maybe 420 or 425 milliliters. So that means the urine cannot take heavy volume before passing urine. The bladder cannot take heavy volume before passing urine. So every small urine that enter, it will come off. So frequent urination will be happening. So you think you're getting pregnant or you're having diabetes, because people would believe that the people that can keep plenty are sugar again. But not all the time. So most times check for fibroid too. Alright. So we talk about somebody's stomach getting big, your belly getting big, you think you're getting pregnant. So other cause will be absence of menses. You can see your period for long. Because what? The fibroid grow right here. And blood in the place. So what can happen, another symptom that will happen is some of the blood are supposed to be released. They will leave the wall, but they will set here. It will set right over the fibroid. So there are some force that will push this fibroid away in case the fibroid is not big enough yet. So the weight from the blood that will come and share and sit here will push this fibroid away on side, and the time that the blood will stay here, the blood will appear very dark. So once in a while, a dark clot just comes out, suspect fibroid and do your ultrasound. So these are symptoms of fibroid. So what about treatment? How do we treat fibroid? It depends on the location again, it depends on the size of the fibroid. So one way is when you have small fibroid inside here and it doesn't cause any harm when you do not go for surgery, don't bother you. So research have shown that you can take certain medication to shrink the fibroid, that means to make the fibroid to stop growing and make it narrow in size. But don't get me wrong, you can't get it away, it can't clear it away, no. They have not discovered that yet. So what you do now, instead of the fibroid growing bigger, it can help you to get in size until you need to do a surgery to remove it. But in the case that you don't have any fibroid here, You don't have any fibroid here. Everything is flowing well, flowing well, flowing well. We just have some minor, small one here, because remember you can have 1, 2, 3, 4, 5 at the same time on one person you trust. Small one can develop, small one can develop. So you got plenty to develop all of this, so that because of the small things somebody going to open you, no. So the doctor will advise you, since it's not growing, it's not affecting your ability to bear child, don't trouble it. Leave it like that. And just do your normal life. They'll tell you some pieces of advice to follow. Do body exercises regularly. Avoid heavy weight. Don't get too big, too fat. Reduce your intake of too many birth control pills, most especially tablets. Alright. So these are ways in which we can look at the treatment aspect. But one final treatment process is operation. Surgery. If the fibroid is big, like we said, one can be here and it's causing problem for you in your childbearing age, go for surgery and it can remove the fibroid and the problem is solved. So fibroid is causing most women to appear barren, blocking tube, blocking cervix. So this is a problem. Thank you so much. Keep following this page. Share this video, like it, comment, tell us. Even if you want to appreciate us, we'll send our number and we'll give you our contact so that you can support the process of teaching. So thank you so much. This is Conditions Dennis. Keep following for more. Thank you.